the SLOE today, which stands for Standardized Letter of Evaluation. And like Tiffany mentioned, I had the pleasure of being on the SLOE committee, along with core leadership, EMERA leadership, as well as CDEM leadership. And I see a few faces, at least one face on here that was on the committee with me. And we had a really kind of robust and interesting discussion about revamping the SLOE. And this was really a process that was 2 years in the making. And as we go through the slides, you'll see a little bit more about our processes in revamping the SLOE, with the hopes that it will continue to be a robust piece of the application for both students as well as programs. We can start by talking a little bit about the background. I'm unsure what my audience is. So like by show of thumbs up or hands, how many of you are medical students? Are there any medical students here? Scrolling through. No med student. One med student maybe? All right, awesome. It's great to be a student and to learn more about what's going on in the application process. How many of you are clerkship directors? A lot of clerkship directors on here, which is awesome. I encourage all of you, if you're not members of CDEM, to look into joining us. We are an academy within SAEM, and we would love to have you. And then how many of you are program directors? And some of you may hold multiple hats. So a couple of program directors on here. Okay, wonderful. Well, it's always great to know your audience, and thank you all so much for sharing that with me. So we are going to talk about what you need to know about the revamped SLOE. And I am the person who is here speaking with you today, but I like to think that I am here with the rest of my SLOE committee. I see that Erin Carl is here, and we'll show a slide in a couple of minutes about all the other people who are on the SLOE committee who are able to make this happen for you. Next slide. The introduction and the goals of this talk. First off, we're going to define the SLOE, or what the original intentions were when a standardized letter was created for application into emergency medicine. And we're going to talk a little bit about the history of the standardized letter for emergency medicine. Next, we're going to get into the meat of the talk, and we're going to talk about changes to the standardized letter, why we made the changes, and what will look different actually. And we'll go through the SLOE in pretty good detail. We're also going to touch briefly on how will these changes affect letter writers and readers. And when we think about this, and when we get to that section, I'd really love to spend a whole bunch of time engaged in discussion with all of you, and have some time for questions and answers about the SLOE, or if you have any concerns that we would benefit from discussing as a group, I think that would be a great time to do that. So the SLOE actually started off as a SLORE, and standing for the Standardized Letter of Recommendation. And that was first established in 1997. And the fields of emergency medicine were really incredibly forward-thinking when we developed this standardized letter. In 2014, it changed to a SLOE, a Standardized Letter of Evaluation, rather than a recommendation. And the thought process behind that was that although many times this is a letter of recommendation, there are still times that we want to think of it as a letter of evaluation. And one of the things that I think has always been wonderful about the standardized letter in emergency medicine is that our ultimate goal is to pass on accurate information to residency programs. To have that group letter be a great depiction of what that student will be like as a resident, as accurate as we can based on our time with them. Can you go back one really quick? In 2016, we got fancy and we changed to an eSLOE, which is an electronic SLOE. And this has some advantages that you can carry forward data, and you can save things in your SLOE from previous years. And it also serves as a wonderful and excellent database of information that we can look back at it as educators to learn more about our students and how we evaluate them. And then drum roll please, in 2022, the new SLOE came out, and it's going to first be used in this application cycle, the 2022-23 application cycle. When the standardized letter of recommendation first came out, the goals were for it to be standardized. Obviously, that's the first word there. And the thing that's so wonderful about that is that we're saying the same thing about each and every student that we're writing a letter for. We wanted it to be concise, and I joke around and I say that emergency medicine physicians have short attention spans, and that's why we want a nice, concise letter, so we can look at it and we can really be efficient in our review of our letters, with the understanding that the things that are important are not just the check boxes, but also that we really kind of weigh in and pay attention to those narrative comments as well. And then the last thing here is that we want it to be a discriminating letter. So we want to make sure that we are passing on accurate information. And as we were rethinking this standardized letter, we really use these similar tenets to make sure that the changes we were making were in a similar vein, that we were really holding true to the original goals of the individuals and educators who first developed the SLOE. Now, like I said, we were really groundbreaking here. And over the last 5 or 10 years, so many other specialties have leapt on board and are starting to do standardized letters for their residency applicants. Orthopedics, ENT, dermatology, internal medicine, OBGYN, internal medicine, and OB are some of the recent joiners to the club here. And it's very interesting. I am a big standardized letter nerd and have thought about and read standardized letters. And I have taken some time, and if any of you are interested and are a standardized letter nerd too, you can Google what all of these letters look like and what their formats are. And it's very interesting to kind of see different letter formats and what different specialties value. Each of them have done their own individual educational research on their letters. Some of the letters really very, very closely mirror our emergency medicine letter that we had established. And I've spoken with many of the individuals who have developed these letters in other specialties, and they all say we look to the emergency medicine letters as kind of our initial steps because we were the first people who really were using the standardized letters. We, so CORD and CDEM and then EMERA created a SLOE committee, and we'll talk on the next slide about why the SLOE committee was convened or reconvened in 2020. So over the years, there have been a few SLOE committees who have really taken deep dives and examined the standardized letters that we're using. For this SLOE committee that was reconvened in 2020, myself and Cullen Hegarty were the co-chairs of that committee, and we had a wonderful and thoughtful group of educators who we worked with over the last couple of years. Their names are here, but Doug Franzen, Nicole Dubosh, Kathy Hiller, Joe House, Chris Doty, Alexis Pelletier-Bowie, Annalie von Reinhardt, Aaron Carl, all deserve major shout outs. We had many, many Zoom meetings together, and it's actually quite funny because in the age of Zoom, Cullen and I actually worked together for 2 years and didn't meet each other in person until we met at SAEM this past year in May. So we really, we saw each other's little faces on Zoom for many, many meetings. And then our CORD liaison was Bo Burns, and our CORD team was Annie K. Irby and a whole bunch of other people. And additionally, one person who's not on here has been our fabulous programmer, Kevin Hamilton, who really deserves an incredible shout out because he really put all of, and like you have an animator who or a screenwriter or something who takes all of your thoughts and ideas and puts them actually into practice. That's what Kevin Hamilton did. And he really has done an amazing job and has been great at troubleshooting as the SLOE has been released and people have started to use it. This committee was reconvened in April 2020, very shortly after the CORD Academic Assembly, and there was an email from the CORD Board of Directors. The goals or the charge we were given was to update the SLOE. And there were a few reasons that This was a goal that was given to us. As many of you know, there are a lot of changes that are taking place in medical education. This kind of call to order also took place right at the beginning of COVID, and the OSLO was kind of born of this, whether which was met with questionable success. But the USMLE going to pass fail, a lot of medical schools through COVID, and this is something we didn't necessarily anticipate, have gone more to pass fail grading over their clinical years. And also we know that we're using standardized exams in our rotations that could potentially add value to our standardized letter. And we really wanted to make sure we were bringing best practices forward for this letter. So we were really, kind of were met with this challenge and faced with this challenge. And we really all jumped in kind of feet first and got to work very shortly after this committee reconvened. Our goal by July 2022 actually was, it was a very lofty goal to have this done by July 2021, because it was really a robust process and we wanted to make sure we were being very thoughtful about it. But the goal was to create a more refined SLOE letter to address some of these other changes that were taking place in medical education and on students' applications. So like I said, we have representation from CORD and CDEM, and we went through a whole committee process where we surveyed CORD and CDEM the community. Many of you might have answered our survey, and we also looked back at data from prior SLOEs. So we'll touch very briefly on the SLOE data from 2016 to 2021. Like I had mentioned, the fact that we have an electronic letter has really, really allowed us to look back in a very detailed way at what has been written in these letters and what has been, how we've ranked our students, what are things that we think worked well, what are things that we think might not have. A couple of things here. So we looked at the rank list estimate, and one of the things that many people had always highlighted, and especially as advisors, we always struggled with who goes in the lower third. Are there, what students fit into that category? And as you could see here on this rank list estimate, this is really skewed very much towards middle third, top third, and top 10%. And this isn't a third distribution, right? So we see that there are far more people in the top third category and the middle third category than in that lower third category. So we recognize that maybe putting people in these buckets for both the global assessment and the rank list assessment was maybe not super value added. This other chart looks at the number of SLOEs that were written every year. You could see that this number kind of climbed over the years from 2016 to 2019. In 2020, we see an expected drop of a little less than half. So we go from about 8,000 SLOEs in 2019 to about 5,000 in 2020. And the reason for that was limited numbers of away rotations for our students related to COVID-19. We also see shifts to the left, and I have left in quotation marks because we actually on our graph do not have it necessarily going to the left, but that's kind of standard terminology for shifts to the higher rankings. So traditionally, if you're looking at scales, more often than not, the higher rankings are to the left. And we see that for these standings by year, again, it remains relatively consistent over the years, but we see that there is a tendency to have more students in these middle third and top third categories and less students in these lower thirds, and a very, very similar trend when we look at those applicant characteristics. And those are the things that were historically in section B of the SLOE, where we look at commitment to emergency medicine, work ethic, differential diagnosis and treatment, teamwork, communication, and caring. You could see a very, very dramatic shift towards top third in those categories and above peers in those categories. The one exception here is differential diagnosis and treatment. I think that as educators, that's one of those things that is the easiest for us to see and assess. And I think the easiest, sometimes one of the simpler things to see if students are struggling with compared to some of the rest of these categories. Another thing that has come to light over the years is that there are some challenges with bias in some of these categories that has been found. Specifically in the category of commitment to emergency medicine, we found that there were lower rankings for students who were like non-white students. So this is something else that kind of came up a bit in our discussion when we were thinking about, rethinking and revamping the SLOE. The other thing that we did, in addition to looking back at data, is we surveyed all of you, and this shows kind of the distribution of the survey information that we got back. And you could see that there's really, I love this little pie chart because it really shows that there's representation from all over the country, right? It is like almost very, very even. Like there's one person that always wants a little teeny piece of pie, right? And that's like the light pink color. But otherwise you could see that it's a pretty equal distribution from, from across the nation. And we love that it's a representation of people from all across the United States who will be using the standardized letters. There's also a great distribution for roles within education. It's divided between program directors, assistant and associate program directors, clerkship directors, and core faculty. So we really have representation from the main groups of educators within the, with that kind of touch with our students as well as with our residents. We divided our data to asking people, do you have any suggestions for changes to the different sections? And again, we'll go through the sections in a little bit more detail on the new eSLOE, but looking at background information, there's less people that want to change that versus looking at like section B, which is those like characteristics in emergency medicine, and section C, which is kind of the global ranking section. Are there things that you would want to change? And people wrote in incredibly thoughtful ideas and suggestions. And as a committee, we read through each and every one of them and really took them all into consideration as we were going through this process. So the question is, what will actually look different on the SLOE, and how does this affect all of you? And I think this is really kind of the meat of the talk here, and the thing that most of the people are here to see and to learn about and hear about. And this is kind of what the top of the letter looks like. So the first part is always what application season it is. This letter that we are specifically deep diving into is the official like eSLOE. All of the other SLOE letters have changed their formats and adapted their formats to mirror this format relatively closely, although they do have some differences on them depending on what they are. Just as a quick review, the other SLOE formats are the OSLOE, which is an off-service SLOE, which is a SLOE that your students can use for off-service rotations. There's also a non-emergency medicine residency SLOE, which is a SLOE that can be written by a faculty member from a from a place that does not have an emergency medicine residency program. There is a subspecialty SLOE, which is a SLOE for students who complete a rotation on a subspecialty rotation. And examples of that are toxicology, or pediatric emergency medicine, ultrasound, and those are slightly different as well because you may potentially have less clinical experience with your students. I see that Tiffany put in the chat, feel free to ask questions. Definitely, if you have any questions at all, please feel free to put them in the chat and we'll make sure that we get to them all. Oh, just one thing on the last slide that I meant to mention is I have read this year's instructions. It's very important, especially with these changes, that you read the instructions. I know it seems really kind of, you only have to read them once and then you could check it off. But with the changes, we really want to make sure that people understand kind of some of the differences that are there. So we really ask that you not just check the box, but that you actually go and read the instructions. They're not very long. So we'll do a show of hands again. Who has already completed a SLOE in the new format or been on the eSLOE site? You see just one hand? The rest of you were waiting to hear this talk, so you knew what to do. A few hands. And I hope that it was a smooth experience for you. We definitely can take time later on. And hopefully that, it was something that was relatively easy to navigate, and this talk can maybe help others kind of navigate that process. So now we are going to take a little bit of time, or I'm going to take some time to go through each individual section that's on the SLOE, and I sort of have broken it up into chunks, and we'll look at them in detail and highlight some of the things that are different than before. So this is kind of the intro and demographics section, and this is what you see when you first, that's on the top of the letter. And many things here are the same. One thing that will look a little bit different is your institution, and that will be automatically filled in. Something that came up as we were talking, and many of you have maybe experienced this as you read a letter, are that you may be at like doctor's hospital, and we may not know necessarily where doctor's hospital is. There may be a bunch of doctor's hospitals or Good Samaritan hospital. So by having this category here, we're able to know as writers and readers kind of exactly what hospital it is or what institution it is that you come from. There's also a category here for what student type it is, and within there, it's a home student or a visiting student. And it's nice to have that at the top of the application. We can always usually suss it out as you go through the file, but it's nice to just have it at the top of the SLOE. And then one other category we added in up top here is what sources of information did you use in compiling this SLOE? And within there, we have formal and informal feedback from residents or faculty, performance in non-clinical activities or exams, feedback from administrative or interprofessional team members. And we think it's important to know what information you're actually, like who you're gathering information from for the SLOE. And many of you may just say it's from formal feedback from the faculty members on the evaluations. And other people may get feedback from all of these different sources, right? Sometimes you hear from your course coordinator, that person was really awesome. That student came in and they were really rude to me, right? And it's important that we use that information that we gather from those individuals to go into our letter and pass that information along to residency programs. In the latter portion of the background information section, we ask about what is your nature of contact with this applicant. And this is a question that was on the prior SLOE, but the categories here are a little bit different. So we ask if you were an advisor, if you knew them through the emergency medicine interest group. We also asked who the rotation was taken by at your institution. Are you a required rotation? Are you using all 120 people that are in the medical school class as your comparators, or are you using 15 people who come and do your advanced rotation as your comparators? So we want to make sure that we're thinking about what group it is that you're using to kind of relate your student to when you're writing a letter. We also have a section for grading scheme that has been there in the past. We have hopefully a relatively seamless way for you to say what your grading scheme is, and then for that to carry over from letter to letter. And there is an opportunity for, if none of the grading schemes that we have there, so none of like the common grading schemes that we have as choices in our drop-down menu that are there, there's a way for you to kind of make your own and use that to carry forward for your letters. We also added in a rotation exam section. There's a way for you to say, we do not have a rotation exam, but there are a few options for the SAEM exam or the NBME exam, depending on what you use. And you could say the grade that the student received, and then the average exam grade at your institution. There we have choices of whether you use percentile or percentage for your grade. So raw is like a percentage score. And then if you use percentile as your comparisons, then there's an option for that as well. Other things that are changed is that there is a calendar for rotation dates. So you can go ahead and, similar to when you're like making a reservation for a hotel, you go and you click on there, and as opposed to like having to write in the dates, you could say the student rotated and you click on the calendar months, August 15th to September 15th, or whatever dates it is that the student was rotating with you. And the goal for that is to really kind of help with ease of letter writing. Again, we talked about who is the rotation taken by, and categories there are all students, or was this an elective? And then, like I mentioned, it includes the exam score or type of exam. Were there some questions about the exam score, Tiff?
Yeah, so I see William Dixon asked, are we required to include grades for exams? Would need to advise our students, as we have not historically reported them in our SLOE narrative.
So I think that is up to you. I think if you have an exam and your students take an exam, you can definitely report it. I think it's okay though, if you, like for my rotation, my advanced rotation, we actually don't have an exam. So there's a way to say like, no exam administered or not applicable. But do your students take an exam, and are you asking if you need to report the score? Are you required to? Is that more the nature of the question? I'm not sure if people in the audience.
No, they do take an exam, and it just, it's part of our grade, whether they get honors or pass fail or whatever. So it kind of is folded in already, but I don't mind reporting it. I would just need to tell them, hey, now we're reporting it as part of the SLOE, so they know.
Yeah. I would say if they take it and it's included in their grade, I think it would be reasonable to put on there. But I suppose you could, you could leave it off if you preferred to.
Maybe this year I'll leave it off. Next year we'll be able to advise otherwise.
Yeah. What do others think on that?
Sharon, I have a question. If
Yeah.
you were to advise the SLOE writers to include or exclude the exam grades, would you advise them to be uniform about, including it for everyone or excluding it for everyone and not pick and choose?
Yeah, I would say definitely being uniform about it for your institution, I think would be the best thing to do. So if you don't want to include it, and I understand this is a little bit debatable, right? For the same reason that the USMLE got rid of grades and made it pass fail. So we debated back and forth a good bit about whether or not this was something we should include on the SLOE, and ultimately we decided to include it. But I think being universal about it and having kind of a standard policy across the board is probably the best thing. Section A is one of the sections that looks probably the most different. And here in Section A, you could see these are kind of core skills that we want our students to be able to take with them to residency. And looking at this, the categories are fully entrustable, mostly entrustable, and pre-entrustable. These are things that come from the AAMC, from the EPAs, and while the AAMC is making a very large push to use these fully entrustable, mostly entrustable, pre-entrustable, we recognize that a lot of people may not be completely familiar with it. One thing that we have here, and for those of you who have been on the letter, we have an ability for you to, I have it on the next slide, but hover and discover, which I always joke, for many of you, if you use Epic, that's like a very big Epic thing that you can hover and discover. So, but you can hover over this fully entrustable, mostly entrustable, pre-entrustable in each of these categories, and it can give you an idea as to what that kind of student will look like. So for example, for the ability to perform a focused history and physical exam, that's a student who can really do that very independently. Mostly a fully entrustable student. Mostly entrustable is they get most of the details right, but sometimes they leave some stuff out. And pre-entrustable is that's probably something that they still need a good bit of supervision with. On here, we have focused history and physical exam, ability to generate a differential diagnosis and formulate a plan. We have ability to perform common ED procedures with the understanding that sometimes people are not able to assess or do not assess whether or not their students can do common ED procedures. And that's why we have the category of unable to assess. So if this is something that you really don't look at on your evaluations, that you don't observe students doing, if you don't feel comfortable saying whether or not they are in any of these categories for common ED procedures, you can use that unable to assess button. And then their ability to recognize and manage basic emergent situations. And again, for each of these categories, we have a hover and discover feature. And like I mentioned, this is based on the EPAs, which are the AMC domains for medical students. And it also pulls in from the NCAT for emergency medicine. And the NCAT is a validated EM assessment tool. It was actually developed a number of years ago at a Cord Academic Assembly in the CDEM track. And a bunch of educators had conversation about and went through a very robust process to develop the NCAT. It's used by some institutions nationally, and other people may consider using it as if they're able to. As the SLOE kind of comes more into fruition, it may be very helpful to use the NCAT EM tool as you're evaluating your students over the course of a few months. Section B also does look a little bit different. And here we're looking at compassion, sensitivity, receptivity to feedback. Just to rewind for a quick second, in section A, we're looking at really criterion reference things. And what that means is we're saying, how good is your student at doing this? How good are they going to be when they start emergency medicine residency programs? This is not a situation where you're comparing student A to student B to student C. This is saying, how good is student A at this specific thing? Next, looking at section B, we're saying, how good is the student kind of in comparison maybe to other people who are applying into emergency medicine? There is a category here for not acceptable for an EM resident. Again, we anticipate that that category will be used pretty rarely, but we have it there in case it's something that needs to be checked off. Here we have a Likert scale of 1 to 5. We expect that many students are going to be in the middle, that 2 to 4 category. And as educators and letter writers are filling out your letter, we expect that this will look like a bell-shaped curve distribution, so that you'll have a few outliers that are in the exceptional EM candidate category, a few that are in the minimally acceptable for an EM resident category, but that a majority of our students are really going to fit in that middle category. Something that we've added in here that we think is really important to look at for our students are these kind of questions 4 and 5. So are they punctual? Are they prepared when they show up in the emergency department? Are they prepared when they show up for their didactic time, for their meetings with you? Do they miss a meeting accidentally? Are they, not good at remembering to show up? Are they not good at remembering their stethoscope? And then this next question here, timeliness and responsiveness in completing administrative tasks. We, as a committee, identified this as administrative hygiene. So how good are they at replying to your emails, replying to your administrators' emails, getting their EPIC training done or their computer training done, sending their form to you for their, letter request? And for those of you who are program directors on here and the people who then track this stuff down as when these students become residents, right? This is something you really want to know. Like, is this someone who I'm going to have to harass and email a bunch of times, or my coordinator is going to have to email a ton of times in order to make sure that I get this information back, right? So we think it's really important, especially as more and more stuff is electronic and done over email, that we have the ability to let our residency programs know how students do in this category. So like I mentioned, Likert scale rating here, hope that most will be between that 2 and 4, and you'll have a bell-shaped curve distribution. And added in some domains here, again, on administrative hygiene, communication with staff, communication with patients, for those applicants. One thing you'll note that we took out is the commitment to emergency medicine. And we took that out because we felt like it maybe didn't provide a whole great deal of information and was a little bit problematic on prior SLOE formats. Now, section C also looks kind of different. And here you'll see that for the rank list section, it looks the same. We have those buckets of thirds. So we have a lower third, middle third, top third, and top 10%, as well as the category of still unlikely to be on our rank list. But for the global assessment section, we're asking more how much guidance based on the candidates who your program wrote a SLOE last year. So comparing them to the group last year, how much guidance do you anticipate that this candidate will require to become proficient and meet graduation requirements? And this is, again, a situation where we are hoping for kind of bell-shaped distribution. So this minimal category here at the top, so will excel with just a little guidance and support, will be a few students from your program, 1 or 2 students. Standard guidance and moderate guidance will be kind of the lion's share of the students who you're recommending or who you're writing letters for. And then most guidance will be kind of that other end of the bell curve. As a community of educators, I think both UME and GME educators really recognize that a majority of students will actually probably even be in this standard category, right? They're going to succeed with a standard amount of guidance, a standard amount of support. They're going to, do fine in residency. And this minimal and most categories will probably be used, or we're hoping will be used, less frequently. So again, we took away the buckets of thirds for the global assessment and recognizing that most students will probably fall into the standard guidance category, but we kept the thirds for rank list placement. I think it's easier to think about a rank list like where the student will fall when you're thinking about all of your students who are applying. Section D is the written comment section. I left that off here because it's actually stayed pretty much exactly the same. One thing that we do ask and we think is very helpful is for that section D that you write and are clearly explain any situations where a student has a very high or a low ranking. And that's really helpful because I think that we all have read letters where you say, they put this student in this low category and we have no idea why or what behaviors got the student into that lower category. Or maybe they put that student in a really high category and we have no idea what put that student in this very high category. So explaining your thought process and is very, very helpful. And some people would argue that that written comment section is really the most important section that we have here on the SLOE and gives you the most kind of descriptive and paints the best picture of that student, or that's the goal of it. Now, section E, which is the part where you tell us about your institution and where that student rotated, is a little bit different this year. We are asking about what level trauma center you are, what is the annual patient census, ED patient census at the site. And then there's also a spot for you to include more information or a narrative section about what your rotation looks like. All of this information should carry through from letter to letter and should be saved throughout the application season. So what other exciting stuff is going on? So one thing that you'll see when you first log on to the SLOE and as you're writing your first SLOE letter is that there is a survey at first login. It is a very, very brief survey. It should take you only a couple of minutes time. We also, thanks to Cord, have a new, and Kevin Hamilton and the crew have a new and improved site with more storage. We were apparently, like last year, apparently we ran out of storage on our SLOE site and very old SLOEs kind of got deleted. out of necessity. And I think many of you might have experienced that if you were a letter writer last year, that you ran into some issues with the site being full and being unable to save additional letters. So we're hopeful, fingers crossed, that that will not be an issue this year or for many years to come. I've been reassured that we have a lot of storage on the site. We also are hopeful that there's improved ability for autofill for questions that remain the same over an application cycle, that all of your information that you put in there when you write your first letter for the year will carry over from letter to letter and will be able to be used as a template as you write your letters over that application cycle. Now, how will these changes affect our students or letter writers or readers? So I think that we're really thinking about our students in a slightly different way on this letter. I think that some people, if able to, will want to have some considerations for changes to how they evaluate their students. I know that over time, some institutions have used the SLOE format to kind of reflect or use their evaluations to reflect what's in the SLOE. And to make it kind of more easily to plug into that. So we may want to kind of use that moving forward. We also will maybe have some changes to comparability data from prior years, right? So with a new format and some different questions, we will not necessarily be comparing apples to apples, right? So what has been on prior SLOEs and different letters will look different in this letter. So we're sort of starting over on some of our thought processes from ground zero, how we think about and write letters for students. Letter readers may also have to change the way they think of different parts of the SLOE, specifically in the criterion reference section, and also in the sections where we're saying most students will really fall into these middle categories and kind of accepting that as the expectation. I think that from a student process, things are relatively unchanged, but I do think it's so important that they familiarize themselves with the letter, that they understand what's going into the letter. And, while their main goal is to just perform in a, in a standard way or, in the best possible way during their rotation, I do think it's helpful as a learner to know what is going into your, your emergency medicine letter, especially since it looks slightly different this year. So that's about all I have to say. I am a big SLOE nerd and could talk about this for a while. I appreciate all of your time and attention. And I think we have a little bit of time for questions or discussion.
Thank you so much for that amazing presentation, Sharon. I know there were some things that I didn't know and I learned as well. Are there any questions from the group? If not, I have a question.
Sure.
Okay, here we go. All right. So one question from the chat: for unmatched students reapplying this year, will they need to have a new SLOE format or may they use last year's?
Yeah, this question has come up a couple of times. I think that it's, I think that you could probably go either way. I think that it's definitely reasonable to use the letter from last year if the plan is to use the same letter. So I think it can really go, I think it can go either way. I think whatever is easy or convenient is probably a reasonable way to do it. But if you think that the new letter would maybe benefit the student or help them or paint them in a different light or allow the letter reader to get a better understanding of that student, I think that you could definitely upgrade to the new format.
I see another question. If most students fall into the middle categories, how would you recommend readers use the SLOE to compare applicants?
Yeah, so I think that there are definitely sections where, we can recognize our students for their strengths, right? So obviously I think working with students and learners, we really want to make sure that we're highlighting the things that they're good at. And we all have students, right, who have great medical knowledge, who can take an amazing history, who can develop a great differential diagnosis. But they struggle maybe a little bit with their communication style. So in the SLOE, we can really use it to say they are top categories in these specific things. And in the rest of the things, they're kind of in the middle, right? And then we also have students who have great interpersonal skills, who really like assimilate into the ED team amazingly, but then they struggle with other aspects within, within the skills of differential diagnosis potentially, or developing a plan, and really utilizing the letter to highlight the things that they're good at, with the understanding that there's going to be things that they are potentially less good at, or that they are still working on.
Thank you for that. My question to you, or perhaps the group would love to hear your comments or your insights. I know that there's a lot of turnover in academic leadership with new program directors and new clerkship directors. And over the years, I've noticed a trend from as the SLOE turned into the SLOE turned into the eSLOE, there was a movement towards group letter writing rather than individual letter writing. So can you just comment on preferences, or, what your thoughts are in terms of having, departmental educators write the SLOEs?
Yeah, absolutely. I think that the kind of gold standard has been for a group SLOE. And that's a SLOE in which many institutions will utilize feedback from both the clerkship director teams as well as the program director teams, and from individuals who have worked with the students. And one of the benefits of that is that you are really kind of gathering information from kind of all fronts, from, the UME teams, the GME teams. And I think that both of those groups can think about that student in a slightly different light. I think that those are most likely, or the most valuable letter, and the kind of most common thing that we've been seeing as we're over the years. And I agree that that is definitely the trend. I generally will discourage students from getting letters from kind of individual faculty members. And I think that those letters can potentially give slightly less robust information.
Thank you. If there are no other comments in the chat, I have another question. I know that, again, with new academic leadership, there's always a question of that section D with the narrative portion, and what is expected of in terms of a narrative portion in that section. Can you just comment on some things that are expected versus long paragraphs versus what are some helpful things to include in that section?
Yeah, I think the most important things for people to include are strengths and challenges for that student. I think really it's a clinical letter for the most part, right? And I think that one of the big goals is to make sure that we're creating a clear clinical picture of how that student will be. I think that there are times that we really have a lot of knowledge, especially for our home students, about different research that they've done, or different activities that they've been involved in, extracurriculars at the School of Medicine. I do think that there is some value added there, right? So students who are able to engage and complete a research project, I think that there's value added in kind of including some of that information in the SLOE. But I think more often than not, we really want to know clinically, how did that student do? What are areas of growth for that student? What do we predict for them as they move forward?
Great, thank you.
You're welcome.
And I know that there are some technical issues that come up every so often. I know the CORD staff is really great about responding to any kind of error messages and so forth. Certainly, I would encourage anybody who has any problems with technical difficulties to email the CORD staff. And I believe that they put the email in the chat earlier. If not, we can put the email in there we go, in the chat, so that we can work on it ASAP.
Awesome. Yeah, I really can't thank Cord enough for all of their support that they gave in getting this letter up and running. And we're really excited to hopefully have a successful application season and a successful bunch of ESLOs.
Well, thank you to you and Cullen and the entire group that has put in so many hours to revamping the ESLO, and it's really so meaningful to all of our programs, all of our clerkship directors, and certainly our students. So thank you on behalf of Cord.
Wonderful. Thank you so much for letting me be here. And thank you to all of you for your attention.